Tennessee Capitol Report is made possible in part by a grant from Blue Cross and Blue Shield of Tennessee.
We're here. Woo.
Right here.
We're here. Where's Jack?
We're so happy you're here.
Being here matters. That's why Blue Cross Blue Shield has thousands of people right here in Tennessee serving millions of members.
If you need anything else, we'll be right here.
So when it matters, wherever you go, we'll always be right here.
Welcome to Tennessee Capitol Report. I'm your host, Chip Hoback. The 110th General Assembly opened its 2018 session a few weeks ago with a full agenda. There are both new and familiar faces in the legislature this year, and we'll meet as many of them as possible over the coming months in this session right here on your Tennessee Public Television station. And additional content, you can follow us on our new Facebook page. On today's show, we'll get a preview of several of the key issues being addressed in this session. Representative William Landverth is here to discuss a broad agenda for juvenile justice reform. And Senator Kerry Roberts makes his debut on Tennessee Capitol Report to talk about his efforts to change the welfare system in our state. But one of the biggest issues is how to tackle the opioid epidemic in Tennessee. Senator Richard Briggs and Representative Brian Terry, both medical professionals, will explore the game plan for legislation in this year's session. Opioid overuse, addiction, and deaths in Tennessee were addressed just this week by Governor Bill Haslam and the leadership of the state legislature. Let's hear what they had to say.
Last year, Speaker Beth Harwell put together a task force chaired by Speaker Pro Tem Curtis Johnson, who's with us as well. Also want to thank Leader Glenn Cassida. They brought stakeholders together to study the issue and make recommendations. Speaker Harwell, Lieutenant Governor, and Speaker Pro Tem Farrell Hell, along with some assistance from Leader Norris, participated in a working group that we put together to further analyze the issue and formulate opinions. Through all of this work, we have created the Tennessee Together Initiative. Our Tennessee Together plan will be comprised of three components: prevention, treatment, and law enforcement. We will introduce legislation as a major piece of the initiative, and our upcoming budget proposal will include $30 million in state and federal funds to address the epidemic. This is a multifaceted and comprehensive approach, and we look forward to working together with the General Assembly, the judicial branch, and all of the stakeholders around this issue to end this crisis.
Well, I think all of us have a little responsibility. I think even patients need to say, is there another course of action from pain management other than just opioids? But I will say that I've encouraged, and our Attorney General has taken my letter and said, yes, we will do it. We need our Attorney General to look at these pharmaceutical companies and say, what have you done and what is your responsibility? I'm not out to hurt any business, and we certainly appreciate the drugs that help many, many people. But I think the pharmaceutical industry should voluntarily step forward and say, we will help pay for rehabilitation because it's going to be expensive.
Joining me now to discuss reaction to Governor Haslam's comments and to offer an overview of the General Assembly's response to the opioid crisis in Tennessee are Senator and Dr. Richard Briggs of Knoxville and Representative Brian Terry of Murfreesboro, also a doctor and anesthesiologist. Welcome to Tennessee Capitol Report.
Thank you to be here.
Looking forward to getting your insight on this. It's a problem that we've had coming for many years from many different directions. There's a lot of people to blame for it, and we've got to figure out how to solve this opioid problem in Tennessee. We'll start with you.
Well, I was delighted with the program that the governor presented today. It's a three-pronged program that involves prevention, treatment, and law enforcement. And I think this is a program that we're going to find people across party lines, across our philosophical stands, whether we're conservative or liberal, that everyone agrees that it's a major problem in our state that we're going to have to attack.
What's the major part of the legislation that we're going to try to get through this year?
Well, one of the things that Governor Haslam is looking at is, like I said, different pronged approach. It's a multifaceted issue. So we're looking at from an education standpoint, getting education to our schools about the issue, medical schools about the issue. We want to decrease there's a supply side and a demand side. And from a supply side, looking at decreasing the amount of narcotics that are on the street. From either a prescription standpoint or how do we decrease diversion of legitimate prescriptions. And then from the law enforcement side, what we're looking at is there's illicit drugs, the high-powered narcotics that are coming in. They're either being manufactured illegally or they're coming in from China through Mexico, like fentanyl that's up to 100 times as potent as morphine. And then we have other drugs like sufentanil and carfentanil, which they're even more powerful. So again, looking at education, the treatment, looking at decreasing the supply, and looking at law enforcement.
Seems like there's a whole new industry that's come up, and they're using different ways to pay for the drugs, using gift cards. Explain a little bit about how that came about and what we're doing to stop that.
I'll try to go through this very briefly. What we do, we have organized crime gangs that will come into a community. They'll go to retail stores. These are the Walmarts, the Targets, the Home Depots. They shoplift. The next day they bring back the merchandise without a receipt. They get a gift card. They take those gift cards to places like pawn shops or game shops. They sell them at a discount to those businesses, take that money, and then use it to buy drugs. And this is really, they always say, follow the money. This is what's really funding a lot of the drug traffic and the drug buying and selling in our state, and we hope that this will stop it.
Seems like there's legal ways people getting addicted to these drugs, and then when they can't get them anymore, the doctor tries to get them off of the medication. Then they find the illegal resources, and good people are getting involved in bad situations.
Yeah, that's true. And I always talk about whatever we do, we need to look at legitimate patients and legitimate providers. And you know, they're kind of caught in the crosshairs of this, people that are actually trying to help these patients, these chronic pain patients, and the burdensome regulations that are put on them make it more difficult for them to practice. And what you end up doing is you push these patients out, and where do they go? They either go to the street, or they may go to Alabama or Kentucky or wherever they can get legitimate treatment. So whatever we come up with, we want to make sure that we have them protected.
Well, no, I've had surgery, and you get the big bottle of pills, and you don't really need but a day's worth, hopefully, to get over that. Is that part of the problem?
Yes, it has been part of the problem, and Governor Haslam is attempting to address it with his plan. He's going to limit for new prescriptions for patients to 5 days. And what we're really trying to do is to cut down on the number of tablets that are sitting in medicine cabinets that can be diverted either by children, grandchildren, neighbors, someone that comes through. I think one of the details that we'll have to look at, and I do want to reassure patients out there, if you've got cancer, if you've got chronic pain, I think we'll see exceptions to that. But what we really want to do is not have all those extra tablets that people aren't using that can be addictive that are going to be diverted to our children and grandchildren and get out on the street.
And that's part of the problem too, is the children getting into the medicine cabinet of unused pills.
That's correct. And diversion, whether it's from legal prescriptions, that's what we're trying to do is tackle that, and then you know, then you have the illicit drugs on the other side, and that's what's bringing up the supply that we have. And so if we're trying to tackle this from a couple different ways. If you decrease the amount of diversion, and then from the law enforcement side, decrease the supply that's coming in, hopefully we can cut down on the demand side. And then from an educational standpoint, educating our students, educating our physicians.
This is a national problem. We're hearing about it on the national news. We're hearing about it from the President of the United States and Congress. But Tennessee seems to rank pretty highly as this being a problem here. Why is that?
I think we're 1/10 of a percentage point better than Alabama. And in particular, it's not just a Tennessee problem. In Appalachia, where I'm from, that's really the epicenter in the country. If you go through West Virginia, eastern Kentucky, and the eastern part of Tennessee, it seems like we have a lot more there than anywhere else in the rest of the country. And East Tennessee has a lot more than we have in the rest of the state.
Why is that?
I think there's this long tradition. If you think of, let's call them illegal substances, it started with moonshining that we had back when we didn't have anything else for people to become addicted to. We later went to cocaine, crack cocaine. I think it was the meth labs there were more meth labs in eastern Kentucky and the mountains of Tennessee than just about anywhere else in the country. And now we've got this opiate addiction. A lot of it's related to poverty and lack of jobs. I think that people have gone astray and gone into that lifestyle.
I'd like to add a couple things to that. I think from a legislative standpoint, what we passed here, I wasn't part of the General Assembly at that time, but there was the Intractable Pain Treatment Act was passed in 2001, and that basically said as a patient, you have a right to have your pain treated, and if the physician does not treat your pain, they have to provide you with a referral to somebody that will. And what we saw was an explosion of pain clinics here in Tennessee. We actually have more pain clinics here in Tennessee than they do in Texas. The other thing is from an illicit drug standpoint, we've got I-40 and we've got 65, 75 just coming straight through through Tennessee, and it sets up a place for these drug dealers to put out their supply.
Thank you, Senator Briggs and Representative Terry, for being on the show today.
Glad to be here.
Thank you so much.
Preparations are now underway at the General Assembly for a joint convention to host Governor Haslam on January 29th. The governor will probably have more to say regarding opioid legislation in his State of the State address, which you can see here live on Tennessee Public Television tomorrow night at 7 o'clock Eastern, 6 o'clock Central. Joining me now is no stranger to our show, Representative William Lamberth of Cottontown and the chairman of the House Criminal Justice Committee. Let's go over some of the major accomplishments you think your committee has made to this point, and also what are you looking to do at this legislative session?
Yeah, I think over the last few years, we've definitely done a very good job of trying to hold folks accountable, but at the same time, give them a pathway back to prosperity. And so, if someone commits a crime, in almost every instance, minus first-degree murder, I mean, that person's going to have a punishment, that person's going to have a sentence, but at some point rejoin society. And so I think over the last few years, we've tried really hard to focus on how do we make sure folks have a license? How do we get them back to a job? How do we get them the skills they need to be able to be a productive member of their community, while at the same time still holding them accountable for their actions? But I mean, just because somebody has committed a crime doesn't mean we just throw them away and pretend like they're never going to be part of our communities again. And so I think that's been a big step forward in trying to make sure that if somebody needs recovery services, if they have an addiction or mental health issue, that we provide those services. And that's been a real turning point over the last few years of just kind of lock them up and throw away the key and hope they do well when they get out, based on the fact that they understand there's a punishment out there, they being anybody involved in the criminal justice system, to, okay, we're dealing with someone whose life is very well broken for some reason. What can we do to have them see the light? What can we do to help that person not commit additional crimes and, again, be a productive member of their community? Get a job, don't commit crimes, stay away from substances and get the help you need to be able to, not be addicted to a certain substance, or at least not act on that addiction.
Well, of course, it all starts with children, and the recidivism rate, we don't want those children that get in trouble early to be criminals when they're adults. What kind of actions are being taken to help that area?
Yeah, and the Speaker asked me to set on a task force this year, and I was honored to do so, dealing with juvenile justice issues. And I will say that we've not truly done a top-to-bottom sentencing reform since 1989 in Tennessee. And we've tinkered around the edges, and in our committee, we've worked very hard over the last few years to try to make some advances, but there's not really been a top-to-bottom. And so within juvenile justice, that's true as well. And so the juvenile justice system that we have now was really designed to handle a very small number of children from broken homes that, for whatever reason, are acting out in ways that bring them into the criminal justice system. That's no longer what we're dealing with. I mean, there is really a tsunami of children that are winding up before juvenile court judges and DCS that are, for whatever reason, are committing actions that are bringing them to the attention of law enforcement in our courts. And so we've really got to, I think, kind of start back from scratch and say, okay, why are these children acting out? Why are these children committing crimes? What's bringing them into the system? And very similar to what I was talking about with the adults, is it undiagnosed mental health issues? Is it addiction issues? And we have children as young as 12 or 13 that are already addicted to opioids. I mean, we have young children that are being told that certain illegal drugs are not harmful to them. I mean, it's a very different generation. And then when you have over 40% of children being born out of wedlock in Tennessee, you have a lot of single parents out there that are trying really hard to do the job of two people in one. And that's a tough job, and a lot of them do it really well. But there's others that need additional assistance, that when they've got that teenager, when that family's in crisis, so to speak, they've got to have some additional assistance. So that's really kind of what I think we're going to be looking at this year, is what services are needed out there, how do we hold these kids accountable, but again, at the same time, understand that there's kids and they're kids, and there's still a lot of hope for them to be productive adults. How do we get them to that? Because if we don't do something, they're just going to continue to commit criminal acts as an adult, and then we've got to deal with them in that system.
And I guess tracking, that's a difficult situation as well. There's no statewide data collection system, county to county, to be able to track whether or not these kids are getting the help they need.
Absolutely, and that's been another frustration, not only of my committee, but I think of the governor's office and the speaker and everyone else, is that identifying exactly what the issues are, and then knowing whether or not, if you've passed this piece of legislation or changed this paradigm or rule, has it made the desired result? And so we've got to do a much better job of trying to collect that data and find out if a 17-year-old has committed a crime and there was a certain intervention that was tried, by the time they're 20, are they still in the system just as an adult, or are they now a productive member of society? And trying to bridge that gap between really juvenile and adult records while still maintaining that privacy is difficult, but it's something we really have to do in order to know whether or not what we're doing is working.
Now, other states are doing the same thing. They're trying to figure out the same process. Are there other states that are good models for us to follow?
It's going to take a Tennessee solution to this. It's going to take something that involves our parents and our school administrators and our DCS officials and our judges and DAs and attorneys and really just everybody in the community, and especially our churches, our faith communities, to try to, surround these kids with really love and a strict set of rules to say, look, here's how you've got to live to be able to be a productive member of society.
Representative William Lambert, thanks again for what you do with the General Assembly, and I appreciate you taking the time to be on the show again.
Well, thank y'all for having me, and I really appreciate you guys focusing on these issues. The safety of Tennesseans is just absolutely of critical importance to all of us, and we've got to do a better job of making sure we keep Tennesseans safe.
One of the biggest changes for Tennessee's legislature in 2018 is new office space. After decades in the underground legislative plaza, legislators are now seeing the light of day in the newly refurbished Cordell Hull building across the street from the Capitol. Let's take a look.
I think it was a very wise move for the state. As you know, the Cordell Hull building is seen as a historic building. The original plan was to actually tear this building down, but the Historical Commission wouldn't allow that. And I'm glad, because if you walk through the building, you see some limestone and marble that's unique to Tennessee. So I think we have restored a beautiful building in the downtown community.
There was no sunshine at all in the Legislative Plaza. We decided to renovate it and move the legislature over here. Plus, there was mold in the old building, and it smelled and it leaked, and some of those problems could be fixed, but some were just inherent in the structure of the building.
It was very crowded. It was not handicapped accessible. This building is. And again, we have a larger committee room, so there's places for everyone to sit. We have better access for the office building itself so that members can invite the public here to have meetings. And overall, I think the public's going to be very happy with this building if they have the opportunity to come and visit us.
We definitely saved taxpayers' money in refurnishing this building and not building our own facility.
So the taxpayers actually saved money in this move. I would never have done anything that cost them additional expenses. This was a wise move for the taxpayer.
I didn't design my office. The building was actually designed by Speaker Harwell and Speaker Ramsey, and they did a fantastic job. Everybody seems to like the offices that they're in. It's important to be able to look out and see what's happening and see what the weather is and see the sunshine. The walk is a little longer from here to the Capitol, but we need the exercise, I think. We do a lot of sitting in our job.
Senator Kerry Roberts of Springfield joins us now to discuss an issue he has spent several years on, and that issue is welfare reform. Welcome to the show, Senator.
Thank you for having me today.
Last year, you passed the Program Integrity Act of 2017 on welfare reform that's just become law. Tell us what that bill did.
Well, let me give you a little bit of background, if I may. So we approached the governor's staff a couple of years ago, 3 years ago, with what we thought would be a comprehensive reform that would try to detect fraud in the welfare system. We felt like in Tennessee that we might lose as much as $125 million a year. So we wanted to implement what we thought would be some common sense reforms that would detect abuse in the system. What we discovered is we weren't quite ready to get there. We had systems that didn't talk. We had departments that didn't talk. We could spend a lot of taxpayer dollars to get those departments and systems to talk, or we could wait until some new software and some new initiatives rolled out that would make it easier to do. So our legislation last year was really the first step in a multi-step process to help us to detect fraud and abuse in the system.
And do you expect that there's a lot of fraud and abuse in the system right now?
Well, we do. It's very hard to say. I mean, we rely upon the estimates of think tanks, and the think tanks tell us that it might be as high as 125 million in Tennessee, but we really have no way of knowing. We also know when we talk to investigators, there's a lot of intuitive knowledge, there's a lot of anecdotal knowledge. So for example, we know there's a lot of trafficking in EBT cards. So we know that EBT cards are used out of state and in places that they ought not to be used. And sometimes that's legitimate, but quite often it signals that there's fraudulent activity taking place.
So what are the agencies that you had to bring together to try to find this kind of information?
Well, a great example is the lottery. So if somebody wins the lottery, then you would think that they lose their eligibility for some type of welfare benefit. The problem is if the lottery doesn't report to the other agencies who's won, who has winning proceeds, then they can continue to collect that check. Although it's illegal for them to do it, they often will do it. So that's a great example of one, as we say in government, often the left hand doesn't know what the right hand is doing. So what we've tried to do is force the communication between the agencies, and we want to do it, of course, in a cost-effective manner.
I guess the technological advances, there's a lot of different ways to track people and things.
Right. Well, and we're dealing with legacy systems in many cases. So for example, state government doesn't have the state-of-the-art software where it's easy for one agency to talk to another. Often one agency has the new package that's rolled out or the new version, but the other agency still has the old version, and the data doesn't map between the two. So as we are modernizing all of our systems and getting rid of the older legacy systems, we're finding that they communicate a lot better. So just by virtue of software upgrades, we're actually solving some of the problems without any other effort.
Going into a new legislative session, what are the goals for this welfare reform package in this session?
Well, when we approached the governor a couple of years ago, they basically said, let's not do it all yet, let's wait on some things, because we think some of these need to be vetted a little bit more, they need a little bit more effort, or it might be that sometimes you can do better if you bite things off and do them incrementally than try and do it all at once. And so in the package this year, we have several things that we're looking for. Number one is we're looking for increased authority to investigate when we believe that somebody's working, they've lost their eligibility. Sometimes we need to be able to go into an employer and subpoena records and get the cooperation of the employer. We don't always get it. So we've added some teeth to that law. We've also targeted the replacement of EBT cards. So just in case our listeners are not aware of this, the viewers are not aware of this, you get a card that looks like a debit card, and that's what you use to purchase your food. Well, sometimes people call and say, my card's been lost. Well, has it been lost or has it been stolen? And unfortunately, the way the controls work on the program, it's not as simple as turning off that card because they're preloaded with benefits. So when somebody comes back for the third time saying that I've lost my card, that might signal that there's a problem. Now, maybe it's just they're absent-minded, but it could also signal that maybe some cards have been stolen, some cards have been traded, it's somehow being abused. Also, we've got language in the new bill that allows us to cooperate with other states, because one of the great ways to track down welfare abuse is to see who's registered in another state. If the states are talking, for example, we found out that a few years ago that if you look at the southeast region of the United States, there are people that work each and every one of these states for welfare benefits, and when the states start talking, you find out in many instances that you've got people who are basically millionaires who've been gaming the system among all the different states. Now, that's not that many individuals, but the dollar amount is significant. And that's money, of course, that's not available to the people who need it the most.
Thank you, Senator Roberts, for being on today's Tennessee Capitol Report.
Thank you.
And that concludes our program opening the 2018 session of the 110th General Assembly. But we want to remind you that Governor Bill Haslam will make his final State of the State address to a joint convention of the legislature tomorrow night at 7 o'clock Eastern, 6 o'clock Central. So please watch on your local public television station. This is the final year of the 8-year Haslam administration, so it will certainly be an historic moment carried live by Tennessee Public Television. We'll see you again on February the 25th for another monthly wrap-up show. But until then, like us and follow us on Facebook to see behind-the-scenes content, bonus material, and more coverage of the 110th General Assembly. Thank you for joining us on Tennessee Capitol Report. I'm Chip Hoback.
Tennessee Capitol Report is made possible in part by a grant from Blue Cross and Blue Shield of Tennessee.
We're here.
Woo! Right here.
We're here. Where's Jack?
We're so happy you're here.
Being here matters. That's why Blue Cross Blue Shield has thousands of people right here in Tennessee serving millions of members.
If you need anything else, we'll be right here.
So when it matters, wherever you go, we'll always be right here.